The other big challenge of today is energy. Um, we think we have energy problems now. With the advent of AI, we're finding out that the power required to run an AI center is enough power on one center that can power 2 to 3 cities in 24 hours. That's how much energy we're going to be faced with. How do we do these facilities? And we're less reliant on the grid. I live here in Texas. 3 years ago, we had, maybe it's more than 3 years now, 4 years ago, we had Snowmageddon. We don't get snow here in Texas. We got 5 to 6 inches in southern Texas, and it shut the state down because the grid collapsed. So the normal, usual response to this is hospitals have emergency generators. Well, they're only good for so long. So what is being looked at now is how can we bring microgrids in? And microgrids are, it's another trendy buzzword, but it's really a way of offsetting traditional power usage and shifting things to an internal grid that the hospital can survive on if needed for an extended period of time. HVAC systems are being rethought now, where I'm giving off heat in my HVAC system, but how can I recapture that heat and use it in a geothermal way to help give me the power I need? And then, of course, as usual, you got to have redundant ability to start up power when you need it off, and then, black start capabilities. That is, I got to be able to turn this stuff on almost immediately if I need it. The other challenge that you put into this is the financial piece. These systems that we're talking about are expensive. So you got to balance the cost versus the risk, and what's my upfront investment versus my long-term return on that investment. And at the end of the day, you got to remember, the hospitals are here to service patients and protect the patients as well as the staff. And we get back into sustainability. The thinking used to be, I do sustainability because it was good for the earth. And that was fine, because there's a lot of things we can do that to reduce our carbon emissions and become more green as we go. But really, when you look at it in this sense, it becomes more of risk mitigation and a financial ability. You can lower your cost, and if you lower your cost in this way, and you can prove empirically that what I am doing benefits the hospital, benefits my patients, protects my staff, all things lead back to insurances. And you can actually, if you work with your insurance company, you can actually reduce insurance premiums and property insurance, because you're demonstrating that I have taken these steps to stabilize my environment, stabilize my operations, no matter what the outside elements are, be it a natural disaster, an epidemic. These are the kind of things that insurance companies love to hear about. So if you start thinking about them as a financial and risk mitigation, then you can begin to justify and reduce the ROI. Improve your ROI. Some of the lessons learned that we had in all this was, again, I kind of go back to COVID and some of the natural disasters that have been all over the news last couple of years. You got to have a good surge capacity. You got to be able to isolate and turn on a dime internally in terms of expensive space, critical care space when I need it, leverage telehealth in ambulatory care settings. You don't always have to go in to these facilities, so they can reduce their footprint a little bit because they're utilizing a lot of the telehealth initiatives now, and working with insurance companies. There are insurance companies out there healthcare insurance companies that if you engage your primary care or urgent care provider via telehealth, that care is free, and any medications prescribed during that urgent care telehealth visit are also free. These are incentives that are getting built in so that people will utilize the technology a lot more and not feel that you've got to do it the old 20th century way of coming in to the facility when you really don't need to. Now, I'm not saying that this is a standard of care aspect, but technology and the physicians and the healthcare providers that are being trained today are understanding how to diagnose and treat over a screen just as effectively as they could if you were sitting in front of them. It's required a whole new education system, and it's required an awareness and an ability to utilize and have confidence in that technology. And the other one is supply chain zones. You know, we have we can set up in the facility where you have that traditional loading dock, where you have inventory that you keep on hand. If you keep, and it's the balance of that, what we used to call just-in-time inventory with, can I get in what I need for the next day or two and not have to hold a lot of inventory? Double-edged sword. If I hold a lot of inventory and I have a natural disaster, let's say a flood, normally, usually, generally, these things are stored below ground floor. So I have a flood, I'm not constructed properly, I just lost all that inventory. If I get it delivered as I need it, I don't have to keep it on hand, but then if there is, again, some sort of natural disaster or disruption in the supply chain, can I get my things delivered when I need it? This is some of the things that are still getting worked out and still being talked about, and it's got a long way to go, but it's stuff that you have to consider. Emergency management, again, we go back to how do I create that system that can withstand a natural disaster or withstand a pandemic. And again, we just talked about securing your medical supply. How do I make sure those supply chains are intact versus holding all my inventory? Nowadays, you know, very, very few people, or I should say institutions, keep all their information on site. Most of that now is stored elsewhere, is what we used to call the cloud. On demand, you get it when you need it, and I don't have to invest a lot of IT space, time, energy, staff to maintain that on site. I can maintain it elsewhere, which is actually the best way to do it, because again, if there's a natural disaster at your facility, your data is now at risk. And then how do we contain a biohazard if one hits, if our systems internally are not constructed to meet that demand? And again, that was a very big lesson that we got from COVID. Everything nowadays is becoming more and more digital. Smart beds. There are beds out there that can begin to monitor patients. When you do that, you can help reduce staffing, critical nurse staffing, especially if the technology inside of the room is geared to be a partner. It's not meant to replace, it's meant to partner with the physical healthcare staff. So there's a lot of technology that are being put into these rooms nowadays that can help with reducing the staff, but not reducing standards of care. Command centers got to be, again, your system has got to be built up. So when there's an emergency of some kind, leadership can come together and get the information that they need to make the smart decisions about what next. Go back to your supply chain inventory. AI, we're using a lot of AI now to help predict what am I going to need I'm at normal operations today. Therefore, this is what my supply chain is going to need. I've got a natural disaster. I've got a pandemic of some kind. What am I going to need above and beyond what I'm using today? And AI is becoming a huge partner in helping predict what those needs are going to be so that I can either pre-stitch or I can increase my input from my supply chain. And then above all else, you got to keep your staff safe. I mean, what am I doing to keep my staff safe? Again, COVID taught us that healthcare professionals will go above and beyond to take care of the patient and put themselves at risk. And what happened is we had whole staffing units go down from COVID, and they were no longer able to care for the patients because they themselves have become patients. So again, you got to start thinking about how do I build those protection systems in, and we talked about, negative pressure, those things, where I can protect my staff so that they can do the job that they want to do, which is take care of patients. What's on the future? Again, a resilient ecosystem, one that's sustainable. Again, incorporating all the digital items that we need. We need to be more modular. If I don't need the space, can I draw down on it, use it for something else? If I need it, I can then activate it, bring it online very quickly, and of course be disaster ready. A resilient ecosystem. And the question at the end of the day is not whether we can afford to do this, it's can we afford not to? Because when these challenges hit, the cost of healthcare at that point, it increases exponentially. So if you're not prepared, but if you are prepared, you can reduce that cost and keep it from escalating and do what you're supposed to do, which is provide care for the patients. So you got to build for disruption. Flexibility is becoming the standard. Your sustainability is going to become part of your everyday operational requirements, and you got to be emergency ready. And with that, again, that was a very high-level view of what healthcare construction, the concepts that you've got to think about if you're in a leadership position and you're involved in building a new facility, be it inpatient or ambulatory. More and more contractors are understanding this. There are architectural firms that understand this. Companies like ourselves that come in and we outfit the hospital, we understand this. And so working together with the entire healthcare construction team, we can begin to build systems that can withstand all sorts of disruption and maintain sustainability. So with that, any questions?